Okay, well, let's go ahead and get started. I see the number climbing. We're well over 100, and I think we're going to set a record tonight. This is our fourth session of Safe in the South Bay, and this is an opportunity for us to provide tips and facts and data and perspective from the different sectors that are involved in being safe in the South Bay. We've had businesses here, we've had schools here, and of course tonight we're here to talk about vaccines. That's on everybody's mind. We think it's a timely topic, of course, and we're very excited to have the panel here tonight. And so, again, what we've done is we've taken some of your questions. The panel members are going to be responding to questions as well as making some brief presentations. And so, again, this is for you to find out everything you need to know as of right now about vaccines. I think one thing you'll probably learn is it's changing daily, some of the information, and that's why we wanted to present this panel tonight. So with that, I'd like to acknowledge some folks that make this possible at the Health District. We can't do all of these things without our partners, and so you see a lot of our partners there along the bottom of the slide. So these are the chambers, the cities, school districts. It really does take a village, especially for an event like the pandemic, and so something the district's been doing a long time is partnering with folks, and never has it been more important than our partnerships with all of these people here, but obviously also the community and the medical community has been a great partner, and we're very pleased to showcase that tonight. Maybe we can go with the next slide. So just want to give a brief overview, and then I'm going to get out of the way and really leave this up to the experts on vaccines. We did want to talk about the Health District's role with vaccines, and this is something that we've been communicating about. First and foremost, we want to provide education about vaccines, and so that's what we're doing here tonight. You're going to learn about that. We think it's very important for people to get educated about vaccines on an individual basis. We know that it's an individual choice about the vaccine for all of us, and we want to make sure that you have the information to make a decision. Obviously, at the Health District, we do encourage people to get the vaccine, and we want to make sure that you have all of the latest data and information to make that decision. So that's what we've really been working on here in the last, well, couple months actually, and you've probably seen that from some of our literature. The other thing that we're doing is the Health District is actively involved in working with LA County, local healthcare providers, city, school partners to bring vaccines to the beach cities. And so we're really looking at sort of two concepts right now. One is what we're calling pop-up clinics. So we're working to secure vaccines that we can then go to places, eligible populations right now, which would be older adults, and really work with the older adult community to make sure that they have access to vaccines. Those would be seniors that are homebound or in congregate settings where they don't have vaccines. And then in the future, when phase 1B, tier 1 is opened up to education and emergency services, we want to be able to assist with making sure they have access to vaccines as well. And then we also are working on being a public distribution site. And so we have registered, and we're all registered and ready to receive vaccines at Adventureplex up in Manhattan Beach. Many of you may know that the district owns that property there at Marine, adjacent to the ball fields. And so we are looking to be, hopefully in the future, a public distribution site. As I said, we're all certified, we're all ready to go. And at this point, we are awaiting vaccines. And so that may be a topic that comes up later tonight, and happy to answer any questions that folks might have about that. And with that, what I'd like to do is turn things over to Lauren and Carrie Ann, who are going to introduce our panel.
Great, thank you so much, Tom. My name is Lauren Nakana. I'm the Blue Zones director here at Beach Cities Health District, and I'm really thrilled to be here with Carrie Ann Lawson. We will be your MCs for the evening, and I just wanted to take you through a few of our Zoom tips and tools for the evening for the participants. We will be using the Q&A feature to submit questions. So you'll find that at the bottom of your screen. We have turned off the chat feature, so please use the Q&A. We are inviting you to submit questions. I saw one come through already as we go, so please send them along as we go through the presentation, and we will organize the evening tonight with some upfront information from our 5 panelists. Then we will address and ask some of the questions that were pre-submitted with people as they registered. And then we'll also address some of the questions that are going to come through in the Q&A live. We are recording this session so that we can also offer this to other people at a later date. So with that, I'm going to turn it over to Carrie Ann, and we are going to introduce your esteemed panel.
Good evening. It's my privilege to start with introducing Dr. Robert Bilder. Dr. Bilder has more than 30 years experience in research on brain-behavior relations, with experience in clinical neuropsychology, neurophysiology, structural and functional neuroimaging, and genomic strategies, as these are applied to the study of both healthy people and those with various neurological and psychiatric syndromes. He is particularly interested in dimensional approaches to understanding mental processes and in understanding the biological underpinnings of creative cognition. He directs the Tannenbaum Center for the Biology of Creativity and the MindWell program of the UCLA Healthy Campus Initiative. Thank you so much, Dr. Bilder, for being with us tonight.
Great. It's my pleasure to introduce Dr. Brittany DeFish. Dr. DeFish is a clinical psychologist licensed in the state of California. She has a private practice here in Redondo Beach and provides therapy to teens and adults who are struggling with depression, anxiety, life transitions, and recovery from past trauma. Since the pandemic began, she has been providing virtual therapy to many individuals who are experiencing stress, grief and loss, relationship issues, loneliness, and fear. She is trained in EMDR, which is eye movement desensitization and reprocessing, an extensively researched and effective psychotherapy method that helps people recover from trauma and other distressing life experiences, including PTSD, anxiety, and depression. She also incorporates mindfulness, self-compassion, and dialectic behavior therapy strategies within her private practice. In addition, she has past experience working as a rape crisis counselor, as direct care staff in foster group homes, as a counselor in schools, as a behavior instructor for children on the spectrum, and as a therapist in community mental health agencies. Dr. Brittany's diverse background has contributed towards her compassion and ability to connect with a wide variety of adolescents and adults. Thank you, Dr. DeFish.
Next, I'd like to introduce Dr. William Kim. Dr. Bill Kim is the Chief Medical Advisor for us here at the city's Health District in Redondo Beach. Dr. Kim joined BCHD in 2015 to provide medical guidance and oversight to all of our preventative health programming and community services, and serves as the agency's primary media spokesperson on all public health related matters. Dr. Kim, who currently owns and operates Beach City's internal medicine in Torrance, boasts more than 30 years of experience as an internist and emergency physician. He spent the majority of his career practicing medicine in the South Bay, including serving as attending physician in the emergency room of the South Bay Hospital, which closed in 1998 to form Beach City's Health District. Dr. Kim also held the offices of medical director, paramedic liaison, assistant medical director, emergency chairman, and medical director again during his 8 years at the community hospital. It's a privilege every day to work with Dr. Kim, and I know you'll enjoy hearing from him tonight.
Wonderful. And I'd love to introduce Dr. Mona Ameet Shah. Dr. Shah practices internal medicine at the Kaiser Permanente South Bay Medical Center. She serves as the physician lead for the medical center's COVID-19 vaccine strategy team and physician director of Kaiser Permanente's regional COVID-19 testing site at Cal State Long Beach. She joined Kaiser Permanente South Bay in 2011 and was named Internist of the Year in 2020. Dr. Shah is a native of Southern California who completed both her undergraduate and medical education at UCLA. Thank you, Dr. Shah.
And our final panelist tonight is Dr. Nava Yeganeh. Dr. Nava Yeganeh is a visiting assistant professor in the Department of Pediatrics, Division of Infectious Disease at the David Geffen School of Medicine. Dr. Yeganeh is an attending physician at Mattel Children's Hospital, teaching infectious disease fellows, pediatric residents, and medical students. She's also the founder of the International Travel Adoption Clinic at Mattel Children's UCLA Pediatric Specialists. Her research focus is preventing transmission of HIV, hepatitis, syphilis, gonorrhea, and chlamydia to infants. She's currently working with LA County Department of Public Health on COVID-19 response efforts. So thank you again to our esteemed panel. We're so grateful for your time tonight and for the information you'll be sharing with our community. First, we're going to start with Dr. Kim to give an overview of the state of COVID-19 and some basics about the COVID-19 vaccine. Dr. Kim?
Yeah, good evening. Thank you for having us. And I want to thank our panelists for being here. Let's move through the slides. The first one is numbers at a glance. These numbers come from February 2nd. You can see the total cases in LA County are just over 1.1 million, with deaths just over 17,000. If you look at the beach cities, Redondo has 2,331 cases, followed by Manhattan Beach is 1,100, and then Hermosa about 832. With regards to deaths, Redondo had 22, Manhattan 11, and Hermosa 8. If you look at the graph on the left, on the bottom, it's the average daily new cases. This is a 7-day running average. And what a relief it is to see these numbers dropping. The graph just to the right, you'll see that the death rates are still high, and this is expected as our hospitalized patients will lag behind the dropping cases. Let's have the next slide. The LA County cumulative deaths are just approaching 18,000. You can see the peak, it really started to peak up after November. So December and January, it's been pretty exponential, really sad. Next slide, please. I like this slide. It's interesting because it shows the new daily cases per 100,000 individuals. It's a 7-day running average. So the top little jiggly lines, you'll see the black line is LA County. Below that's Hawthorne, and Inglewood's the orange one, so yellow for Hawthorne. The beach cities are clustered down below, and you can see Manhattan Beach, maybe because of its less populated, has the lowest new cases per 100,000. But all in all, we're doing pretty good down there at the bottom. Let's have the next. An interesting slide here. These are beach cities cases, new cases per month. And just the take-home message here is that you'll see the huge spike that occurred after Thanksgiving. So over the holidays, December and January have been just horrible. Next slide. Well, about our vaccines, as you all know, we have 2 messenger RNA vaccines available right now that are being administered. There's the Pfizer, BioNTech, and Moderna vaccines. They're both exquisitely efficacious, with the Pfizer about 95% and the Moderna 94.5 or 7%. They're both a 2-dose regimen. The Pfizer is 3 weeks apart and the Moderna 4 weeks. Storage, the Pfizer needs ultra low temperatures, but it can be refrigerated for 5 days and then kept at room temperature for 6 hours. Moderna, we have a lot more wiggle room because it could just be regularly frozen, refrigerated for 28 days, and then at room temperature for 12 hours. Side effects are mild for both. It's mainly injection site pain. There can be some fatigue. Clinically, we're seeing a little bit more in the Moderna group with maybe some chills, low-grade fever, and muscle aches. More so after the second dose. Both of these vaccines have been approved for emergency use authorization in December. This is a neat little slide kind of explaining the pathophysiology of how this little bug gets into us. You know, the COVID-19 virus is a small little particle, an RNA particle, and it's surrounding, all of us have seen pictures of the spike protein that's on it. Well, how it gets into our body is it seeks out our ACE receptor, which is angiotensin converting enzyme receptor. The spike protein is bound to the receptor on our ACE receptor or the receptors. Activation occurs, then the virus is, viral uptake occurs in the cell where viral replication occurs. Then the cell releases the virus into our circulation and causes an intense immune response, affecting all organs, but mainly the lung, but all organs are affected. So what are messenger RNA vaccines? This platform is amazing. So a messenger RNA itself is a very fragile protein. There are 4 units to it. It's so easily destroyed in the body that it's taken years to develop a way that we can send this message to various sites within our body with a message to instill those cells to do something. So this messenger RNA is protected by wrapping it in a little fatty envelope made up by nanolipids. It is attached to the messenger RNA is the genetic sequence of the spike protein. So once it's injected, it goes to our lymphoid tissue where it sends the message within the cell. The cell then translates the message and sends another message to the manufacturing portion of the cell known as the ribosome. It's telling it to make a protein, which is an immunoglobulin, and that's and then so antibodies are made, which recognize the spike protein. So when that spike protein with the virus tries to enter our body through that receptor or gets into our body, it is blocked or destroyed. It will not alter our DNA, so it doesn't really get into the cell nucleus. You can't get COVID-19 from this vaccine because there's no virus in it. There's just some of the genetic sequence from the spike protein. This technology has been around for a while. In fact, the research started about 10 or 15 years ago, and now messenger RNA vaccines have been studied for the flu, Zika virus, rabies, cytomegalovirus. There's even a messenger RNA virus for metastatic prostate cancer, which is now in stage 3 clinical trials. Very, very, very exciting. I think that's about it for the messengers. Thank you.
Great. Thank you, Dr. Kim. And next we'll have Dr. Shah, who's going to share a little bit about the effectiveness of the vaccine, some of its side effects, and herd immunity. So thank you, Dr. Shah.
Hi, thank you for having me. Good evening, everyone. So I'm really here to talk a little bit more about the safety. So thank you, Dr. Kim, for that excellent summary. The safety is obviously of utmost importance to most people, and I think a lot of reasons why people have vaccine hesitancy. People just don't know enough. It was obviously manufactured very quickly, and that concerns some people. But I wanted to just give you some factual information about the safety. Next slide, please. So I really like this slide because it gives you a view of what normal vaccine development is like and what we have done recently with these two first mRNA developed vaccines with what we call pandemic vaccine development modeling. And so you don't need to get into any of the details, but the main point of this is that all of the same steps in order to make sure that those vaccines are safe and effective are done identically to any other vaccine that we've ever created before. It's just that instead of waiting for one phase to be completed before moving on to the next, we are overlapping the phases. So again, not a single step is skipped. It's just that we are overlapping it. And as Dr. Kim had alluded to, if you look at that first portion, the preclinical development, it has been in place for well over 15 years. When SARS first came out back in 2002, 2003, vaccines were already starting to get generated and preclinical development was happening that time. Fortunately, SARS and then later MERS in 2013 just kind of eradicated themselves. And so, the vaccine research didn't really get a chance to develop, but we still had all of that to utilize for this current SARS-CoV-2 virus. And so again, that was used. And another big part of this is that production really of the vaccine happens before the trials are even done. And this is a big gamble for manufacturing companies. If it's shown at the end that it's not safe, that it's not effective, that they're probably, they're wasting a lot of monetary resources and other resources. And so they're taking a big gamble. And again, it will not be going out to the public unless it was considered to be safe and effective. And so emergency use authorization really means that there is a really involved process, again, on making sure that the vaccine is completely safe before we bring it to the general public. And so there's multiple layers that the process entails. The FDA has a large panel of independent scientists who are just excellent at their field. And again, they're independent scientists. These are not from the pharmaceutical companies. And they review all of the available evidence as far as the safety and effectiveness to make sure that this is truly something that would obviously work and is safe for the general public. And so once the FDA clears that, and both of the current vaccines, Pfizer and Moderna, were cleared in December, 1 week apart, then it goes to the Advisory Committee for Immunology immunization practices, who then will make a recommendation to the CDC. So again, there's multiple layers to this. This is not done easily at all, although it is done quickly because of just the pandemic we're dealing with. So some common things that get brought up very, very often are just, okay, it's safe. Now, is it safe for me to get the vaccine? And so I just wanted to paint some scenarios that, again, of common questions. Next slide, please, of who can really get the vaccine. And, before I get into any details, really the majority of people can get the vaccine and should get the vaccine if they're eligible, and obviously determined based on our supply. Obviously, a lot of people have had COVID-19 already. And for those patients that have had COVID-19, it is safe for them to get the vaccine. The only requirements are that they have to come out of the isolation period. So for example, the majority of patients who do okay with COVID-19 are allowed to come out of isolation after 10 days. And so once you've come outside of those requirements, you can get the vaccine. The only limitations on that are if you were a COVID-19 patient and received convalescent plasma or monoclonal antibody therapy, then you do have to wait 90 days until after that treatment to receive the vaccine. If you are pregnant or breastfeeding, the studies, both Moderna and Pfizer, did not involve any pregnant patients or lactating patients. And so we don't have any definitive evidence to say, is it truly safe? Although most experts do agree that it is probably safe. And especially if you have a high-risk pregnancy, for example, your risk of having COVID and the complications from that to both the mother and the baby are probably outweigh the risk of the vaccine. And so it is considered safe, but that is something that you may want to speak with your gynecologist about. If you've had another vaccine, you do have to wait 2 weeks. So for example, if you just received the flu vaccine 1 week ago, you would have to wait an additional week before you get the COVID vaccine. And that's on either the first dose or the second dose. So it's just about timing. It's not that you shouldn't be getting other immunizations to protect yourself. You absolutely should. But just knowing, again, if you are not in the eligibility tiers anytime soon, it's absolutely safe and recommended to still get your flu vaccine. If you are immunosuppressed, meaning for example, you have cancer and you're on chemotherapy, or you have rheumatoid arthritis and you're on certain medication that suppresses your immune system. Again, the specific population wasn't studied, although there were patients that had a lot of different chronic medical conditions within both studies, including HIV, and it was considered to be safe and just as effective at that high level for those patients as well. And the allergies I'm actually going to go to on a separate slide. This is another very, very frequently asked question. I know there's a lot of press about potential allergic reactions with the COVID-19 vaccines that are out on market right now. I really just wanted to point out here that the only true reason that you should not get the COVID-19 vaccine is if you have an allergy or a severe life-threatening allergy, which is also referred to as anaphylaxis, to the actual components of the mRNA vaccines, or if you had the first dose of the vaccine already and had a severe life-threatening allergic reaction to that, then you should not get the second dose. Everything else is kind of fair game. And so the most common is that green. A lot of people have allergies to different foods, different oral medications. Penicillin is very, very common. And for those patients, it is safe to get the vaccine. For anyone who has allergies, we do ask that question. And this is, these are general screening questions that are asked everywhere, regardless of the site you go to. And if you are identified as a person who has had a history of allergies, they will monitor you for 30 minutes as opposed to the 15 minutes. And most of these severe allergic reactions are occurring within less than 15 minutes. And so we're just giving, putting a little extra eye on you, and all of these allergic reactions are completely treatable as well. If you've had an allergy to another vaccine or something else that's injectable, it's still safe, but sometimes, you may just want to run that by your primary care physician or your allergist if you have one. Side effects. So Dr. Kim also alluded to this a little bit earlier. With both the vaccines, you have a pretty similar side effect profile. Next slide, please. By far the most common is just pain at the injection site, which is really on this upper arm over here. Both are pretty equivalent at doing that. In general, the vaccine side effects are more pronounced with the second dose, which is really that boost to your immune system. And what I always tell my patients is that, you know, side effects are a good thing, as much as no one wants to have them. It means that your body is really working for you, that your body has recognized this bad guy and has set out an army to try to protect you. And so that's really how best to look at it. And most of these side effects happen within a day or two of getting the vaccine, and they last for about a day on average. Fatigue, headaches, body aches are other common ones. And then chills and fevers are a little bit more with Moderna, like Dr. Kim was saying. If you're over the age of 55, that's okay. If you're over the age of 55, side effects are less pronounced. So that's a good thing, especially in the elderly population that we are vaccinating currently. And then lastly, just herd immunity. You know, I'm sure you guys have heard about this term being tossed around. Next slide. It's really, we don't know exactly how many people need to be vaccinated or have natural immunity. Natural immunity refers to having immunity produced within your own body after fighting the infection naturally. So we don't know for sure how many people or what percentage of the population needs to be immunized in either way. They estimate somewhere between 70 to 90%, probably closer to the 80 to 90% range. And it's really just a way of, you know, the more people that are protected, the more people that we can protect. And especially for those, for whatever reason, who can't get immunized, especially, you know, for example, our children. Right now, the vaccines are only approved for ages 16 and up for Pfizer and 18 and up for Moderna. And then there's obviously other populations that can't get vaccinated. So it's really for the greater good of common good of our society to get vaccinated. And lastly, it just, you know, I like this slide because it really just puts into one picture what we're talking about here. You know, again, I know a lot of people worry about safety and side effects, but we really have to weigh what's our benefits and what's our risk in medicine as practitioners, as clinicians, as scientists. That's really how we make all of our decisions. The benefits must outweigh the risk. And in this situation with the vaccines, I truly do feel that the vaccine has way more benefit than it does risk. You know, remember the alternate, the risk is getting COVID-19. And not only does COVID-19 cause, you know, severe illness and death, you know, as a primary care doctor, I see a lot of patients who are coming in months after their COVID-19 infections with persistent fatigue, persistent shortness of breath. People complain of memory loss, brain fog, they describe it as. So, you know, it doesn't have to mean death. There are a lot of other scenarios and complications that come out of it. And it's still so new that we don't know how long these things are going to last. So it's really something to consider. Thank you.
Thank you so much, Dr. Shah. Next, we're going to hear from Dr. Yeganeh, who will share about getting vaccinated, how and where to get it, the latest health orders, and she'll update us on the latest news with vaccines and Johnson & Johnson. Dr. Yeganeh?
Thank you so much. Next slide, please. So as many of you know, as we had our surge, there were new health officer orders meant to curb our infection and help us flatten the curve. Some of these restrictions are being lifted as our case numbers go down. So most recently, outdoor dining is now allowed at restaurants, wineries, and breweries. I think it's really important for us all to remember that we have, unfortunately, some very transmissible variants circulating in many populations, and we still have not been able to vaccinate the vast majority of our population. So it's not a time to relax. We still have a very high risk of community transmission. Of course, none of us want to see our cases and hospitalizations go back up. The winter was truly terrifying, and we don't want restrictions to be reimposed. We want to be able to continue to open up our economy as well as our communities. So everyone must do their part in preventing infection and transmission. Next slide, please. So I'm going to talk a little bit about vaccine rollout and distribution in Los Angeles County. Next slide. So for many of you who've been on our website, you see that we are trying to move through the tiers and phases as quickly as possible. We started vaccination in mid-December, and we focused mostly on people working as healthcare providers in the acute care hospitals. We also were focused on vaccinating those in long-term care facilities, as they have been most devastated by the pandemic. We've now finished going through the different tiers of phase 1A, and we're going through phase 1B. And currently we're vaccinating all individuals who are 65 years of age and older. We are hoping to continue to get to other groups in our communities, including those in education and childcare, emergency services, and food and agriculture. Of course, we have about 1.5 to 2 million people now eligible for vaccine, and our supply is limited. So it will take us, unfortunately, more time than we hoped. Next slide. Just to give you an update, this is a little bit outdated. We've administered about 850 total doses. Most of them have been first doses. And like I mentioned, our goal is to move on to the rest of the groups in phase 1B tier 1, including education, childcare, emergency services, and food and agriculture. Our shipments of vaccine range from 150 to 175,000 vaccines per week. And so we unfortunately have had to be very patient. But we're very fortunate that we have so many vaccine providers, but many, many different facilities have volunteered to administer vaccine to the community, including hospitals, federally qualified health centers, community clinics, private healthcare systems, including Kaiser, of course, pharmacies, and then the pods that we've set up all over the county. Next slide, please. So if you are curious about where you are in line and where we are in our vaccination, you can go to vaccinatelacounty.com. We also have a new system that's been, we're piloting through the state called My Turn, and hopefully everyone will be using it in the near future to make their vaccine appointments. And so those are all, they can find any of those on the COVID-19 vaccine website. Next slide. Once you get there, you do get a map of where all our vaccine providers are, which is shown in that tiny little area. But we have vaccine sites distributed everywhere. Unfortunately, our appointments are limited, like I mentioned, just because of the vaccine supply, but that might change, and we're hopeful it will change. Next slide. A main concern for many have been that they got their first dose and then they're not sure about their second dose. And we've really tried to work through this process as best as possible. In the county sites, when you get your first dose, you are automatically made an appointment for your second dose. And we actually put it on your white card saying that you come to the exact same place, get your second dose there. Some of our facilities have closed, so now we're rerouting people to different facilities. We've also asked all our partners, including pharmacies and hospitals, to offer second doses when they make their first appointment. So hopefully this will be much easier for everyone. If you have gotten your first dose and you have your white card, you usually have to just go back to wherever you got your first dose in the appropriate interval, 21 days for Pfizer's, 28 days for Moderna to get your second dose. Most people should get an email confirmation or a text saying exactly when their appointment is. Next slide. So just some things to think about after we finish all of phase 1B tier 1. I think the movement will be more towards age-based vaccine rollout. We are, like I mentioned, using My Turn, and luckily the state is now partnering with Blue Shield as well as Kaiser as third-party administrators to really create a centralized vaccine allocation and distribution system. This will be much easier. That way we can all be on the same roadmap to all over the state to receive our vaccines, and it'll be mostly run through our healthcare system. So I think that we are very excited for this to happen. Of course, as the public health department, our local health jurisdiction will be a provider as well, and our goal will be to help address any equity gaps. Next slide. So I noticed a question about Johnson & Johnson. It sounds like they submitted their information to the FDA today. So usually it takes them about a week to review, and then they'll hopefully give us their call on the EUA in 1 week. And I'm sure that we'll be able to get some doses in February to patients. Their results really showed that the vaccine was highly effective, 72% effective in the US, 66% effective overall in moderate to severe COVID-19. But really what we're looking for is prevention of severe disease and death. And this vaccine seems to be extremely effective at preventing those as well. It's a 1-dose vaccine. It can be manufactured very quickly, and it can also be refrigerated for long periods of time. So I think that we are all looking forward to this new vaccine to be available. Next slide. So I am going to talk a little bit about the education sector, because many of us are very concerned about getting our educators vaccinated as soon as possible. We estimate that we have about 500,000 educators that will need to be vaccinated when it hits that time. Next slide. We are really looking for ways of making sure we vaccinate individuals using a lens of equity. These 2 different maps show where we've had the communities that have been hardest hit by COVID-19. And you can see that the death rates are much higher in South Central and East LA, as well as kind of like Lancaster area. We also have maps looking at health equity. So there's a healthy places index that's been developed in California. And you can see that if you're in the blue areas, you have less healthy conditions of living. And again, you see that there's a preponderance of that in South Central and Southeast LA, and as well as near Lancaster. So our focus is to really make sure that those individuals in those communities have access to vaccination. Next slide. I mentioned the variants earlier. We do know that there are these different variants of COVID-19 or SARS-CoV-2 circulating in our communities. I've listed the most common ones. The most popular one, or I guess in the press, is the B.1.1.7, which was first found in the UK in September. We have, I think, 3 cases that we've identified in Los Angeles County. This seems to increase transmissibility and mortality. There's also other variants that maybe will reduce the impact of vaccinations, although I think that our vaccines are still going to be highly effective at preventing severe disease and death. So I think, again, this makes us refocus our efforts into preventing transmission, because if we can prevent transmission, we will not see these variants spreading in our community. Next slide. And then that last but not least, I think I want to talk about the travel advisory and quarantine. So currently we are recommending that everyone avoid non-essential travel and to stay within 120 miles from our place of residence. If you do leave Los Angeles County or Southern California, we would require you to self-quarantine for 10 days after you arrive back home, and to limit your interactions to only people in your household. And this is true for all of California, but we've also mirrored it in Los Angeles County. Next slide.
Great. Thank you so much, Dr. Yeganeh. And I just want to say, I think we were really fortunate to have somebody from Department of Public Health, Los Angeles County with us, because there's so many questions. So we really appreciate being here. We're going to transition to our next 2 panelists. We're focusing on the mental health aspect of really, I think, the pandemic, but also a little bit about the vaccines. And I'm really fortunate to have Dr. Defish with us. She will share with us a little bit about how COVID-19 has affected youth and adults over the past year, and then some tips for dealing with COVID vaccine anxiety. So, Dr. Defish.
All right. Hi, everybody. Thank you so much. So again, I'm going to be talking a little bit about the impact of COVID-19 and the pandemic in general on mental health. I'm going to be talking a lot of specifically about my practice and my work in the South Bay. And so first, I just want to talk a little bit about grief. This grief model is a model that I often share with my clients because I think it's really helpful when thinking about what we might go through during a pandemic. So grief can be defined as a normal response to loss during or after a disaster or other traumatic event. It can happen in response to loss of life, as well as to drastic changes to our daily routines and ways of life that usually bring us comfort and a feeling of stability. So oftentimes when we think about grief, we often think about losing a loved one, but it can also apply to just, really big changes in our lives that have occurred over this past year. So I want to discuss a little bit of Elizabeth Kubler-Ross's stages of grief, but I'm kind of putting my own spin on it as well to apply it to the pandemic. So some of the stages are denial, anger, bargaining, sadness, and acceptance. And so how I'm seeing this play out with my clients is, the first stage, shock, disbelief, denial, this can't be happening. Anger, why is this happening? A lot of blame and frustration. Bargaining, I'll do anything to change this. I just want this to be over. Anxiety isn't in the traditional model, but I definitely wanted to add it in because the pandemic, I'm seeing so much anxiety. And I think that it can really relate to sadness as well. With sadness, there's, what's the point of going on? And with anxiety, it's like, I really feel like I can't go on. There's so much uncertainty. And then acceptance finally is this stage of, I know what happened, I can't change it, but I can cope and have hope for the future. And so what I'm seeing now is that a lot of my clients are going through the stages of grief, and it's waxing and waning because we're experiencing so many different losses at different times. And sometimes, things might come back and then we might lose them again. And so there's a lot of adjustment and adaptation that's occurring. And what I've noticed specifically during the last period of 2020 and going into 2021 is there's a lot of feeling of burnout and fatigue. So that'll take us to the next slide. So how this shows up and what this might look like in youth and adults. So changes in sleep, feelings of isolation and loneliness, irritability, frustration, withdrawal, engaging more frequently with technology. This is a really big problem that, I'm hearing from a lot of families. How do we monitor their virtual technology use when, they learn online, they're social online? It can be really, really tricky. And so changes in mood, increase in substance use is definitely occurring. And hopelessness, in some of my clients, they are experiencing some suicidal thoughts and hopelessness because they're having a really hard time picturing that light at the end of the tunnel. Fear of leaving the house or anything that might disrupt their kind of new quarantine normal. I think that we're seeing a lot of anxiety around people and worries about health and safety, which they absolutely make sense. They're very valid concerns, but it becomes very, very difficult for people to cope and adjust. Definitely economic insecurity and job insecurity. And uncertainty in daily decision making and uncertainty about the future. I'm seeing a lot of people kind of having decision making fatigue and just struggling with all the uncertainties in their life. And then feelings of dullness, lack of motivation, and what my clients and I call like Groundhog's Day. Every day feels kind of like it blends into the next, and it's hard to find inspiration and motivation to keep going. That being said, I feel like those are a lot of kind of the negative impacts, but I do want to just mention that I've seen a lot of great resiliency and people also finding what's really important to them during this pandemic as well. You can go to the next slide. So lastly, I just want to cover some tips for coping with COVID-19 vaccine anxiety. So I think that it's really important to do your research, stay up to date, look toward officials that you trust. And also, I've been talking with my clients a lot about monitoring how much news consumption and what news consumption and like all of the social media and the notifications that they're getting on their phones. I think that these can be very anxiety inducing. So being very intentional when you consume the information that you consume and trying to research based on facts and officials that you trust. Thinking about benefits compared to risks. Oftentimes with clients, I'll do a pros and cons list, or I'll encourage them to do that for themselves, and making decisions in their best interest. So there's a lot of opinions, a lot of judgments out there, but it's really important to go with what's the best for yourself and your family. And then I'm going to quickly go over some strategies of reducing anxiety. So using relaxation strategies like deep breaths, stretching, taking a walk, doing yoga, meditating, and listening to music can be really helpful. I know for myself, I got the vaccine 2 weeks ago, and I did a yoga practice, meditation, and I listened to some really fun, soothing music on the way. Oh, I also hugged my puppy before I left. So I think doing things that are really relaxing beforehand is important. I wanted to introduce 2 techniques that I guess are not seen as frequently, and I really enjoy them. So one of them is the self-havening technique, and it's designed to increase our delta waves and decrease our fight-flight response. And you can get more information on it at havening.org. There's a lot of great YouTube videos as well. But what you're doing is you're basically going to take your hands, give yourself a big hug, and you're just going to flow your hands up and down your arms, kind of like this. Or this goes really well with safety and sanitation. You can do the washing your hands motion like this. And both of these motions are really helpful in increasing delta brain waves and decreasing our amygdala's response to just turn off our frontal lobes and make it really hard for us to make our choices. So doing this along with doing something like counting backwards or singing a song can be really helpful and effective in creating relaxation and decreasing stress. So next, the self-compassion break. Kristen Neff is wonderful. Selfcompassion.org. Recommend checking some of her stuff out. But I really enjoy using the self-compassion break in a lot of moments of difficulty in my life. And so I think anxiety, vaccine anxiety, it can definitely apply to. So the technique is just really announcing or noting to yourself, gosh, this was a moment of suffering, or, oh, hey, anxiety, there you are, you're coming up right now. And then, after you note what's coming up for you, you just share with yourself, yeah, other people have felt this way too. This is a common human experience. We're in a pandemic. It's okay that I'm feeling this way. And then you give yourself some words of encouragement. May I be kind to myself? May I give myself the compassion that I need? And then we'll go to the next slide. Just lastly, I wanted to talk about social support. It's extremely important to find social support that is comfortable with for you, whether that be a loved one, a friend, family member, pastor, mentor, therapist, support group, whatever feels comfortable for you, so that you can just express your emotions and find tools for coping. And if you have any other questions, you can feel free to reach out to me. Thank you.
Thank you so much, Dr. DeFish. Next, Dr. Bilder will share about the impact of the pandemic on psychological adjustment and well-being. Dr. Bilder?
Well, thank you so much, and thank you for including me in this panel. I'm going to just elaborate on some of the outstanding points that Dr. DeFish has made about psychological impact of this pandemic, and also some tips that you might be able to use And my take, I'm a neuropsychologist, so I double down on the brain side of trying to understand these things. One of the first things is how long we've been dealing with this. You may know we're just about up on our first anniversary of trying to cope with this pandemic. And going way back to 1956, Hans Selye talked about the time course of dealing with stress and what he called the general adaptation syndrome. But the bottom line is when you're first stressed, like in stage 1, you actually marshal more resources in response to some external stressor. And you actually, in stage 2, that period of resistance, your ability to cope is actually enhanced a little bit. But none of us can keep that up. And by the time you get out past 1 month, 2 months, 3 months, as all of us have done with this pandemic, you reach a stage of exhaustion. So the signs of that, while originally during the phase of resistance, you may be somewhat more irritable, frustrated, have some concentration problems. As we continue, all of us naturally show the signs of exhaustion, including fatigue, burnout, depression, anxiety, and decreased stress tolerance. So I think that many of us are experiencing this. For some of it's alarming. You should know this is the natural course of the human brain response to chronic stress. Next slide, please. Now, another really interesting thing that I've noticed, and this is from my own personal experience. Now, on the one hand, there are many people suffering from very major trauma, the loss of loved ones, personal illness, death. I mean, these are, tragedies. And I'm talking about those of us who are lucky enough to be able to be, let's say, at home and then spending 12 to 16 hours a day on Zoom. And trying to focus on people in little 1-inch by 2-inch squares. And what I've noticed is there's a lot of Zoom associated fatigue. I actually developed criteria for what I call Zoom associated delirium. And I think that part of that is that by narrowing our attention to these tiny little spots on the screen, it is hijacking one of our brain's natural ways of dealing with threats. Basically, there's different kinds of attentional styles. If you do open monitoring, that tends to be more relaxing and it's a more relaxed state. But in the presence of threats, we tend to narrow our attentions. Well, it turns out you can do psychological experiments where if you get people to narrow their attention artificially, it makes them more anxious. So here we are confronted with the world's worst global pandemic. And then we're simultaneously doing an experiment on ourselves every day to make ourselves more anxious. So anyhow, we'll talk about that in a second. What can you do about that to get out of the Zoomosphere and try to relieve that anxiety? Next slide, please. Yeah, so another thing I noticed in dealing with a lot of students around UCLA is, they were telling me that they were losing track of time, getting time disoriented. And I was saying, well, how could that be? The pandemic hasn't messed up our time. The clock is still the same. The Earth is still revolving around its axis the same rate. But then I remembered this old concept of Zeitgebers, or biological time givers of the brain. And the next slide, basically, we all know about our biological clocks, our circadian rhythms, and most of our biology and our brain biology is all locked into a roughly 24-hour cycle. And it turns out our exposure to light, our feeding patterns, our sleep patterns, exercise patterns, the temperature that we experience, and all of these external cues converge to give us a sense of not only where we are, but when we are. And when we lose track of those spatial cues, it messes up our sense of time. So just by having the commute changed from driving into work to commuting from your bedroom into your home office, this is totally disorienting, and it's led to many of us to have this altered sense of time as well. So thinking about all these things that the pandemic is doing to our brains, I try to think of some of the stuff you could do about it and focusing on these Zeitgebers. Okay, next slide, please. So one of the most critical things is to sleep. Since our schedule have been messed up, you need to have, first and foremost, to establish a regular sleep-wake cycle. A lot of times the free range clock that we get into during pandemic times is not good. So setting a bedtime, lowering the temperature at night, there are a whole bunch of other kind of tips that you can use. Also waking up on time, alarms may be annoying, but to get yourself locked into a regular schedule, to eat at regular times, to exercise regularly, and then also to adjust and monitor the way you're exposed to light. I was really upset because I'm seeing Dr. Kim here on the screen, and I can see the light from his monitor shining blue-green light into his glasses. This is going to mess up the suprachiasmatic nucleus of his hypothalamus, and he's going to have greater difficulty falling asleep tonight than he would if he adjusts the light on his monitor. So anyhow, we want to make sure we reduce the nighttime exposure to light, get away from the apps, get away from the computers, but also in midday, see if you can get outside, see if you can be, we live in Southern California, we have the opportunity to actually see a great star called the sun. And if you look at it, if you're out there in the middle of the day, don't look directly at it. I think the health experts can comment on that, don't do that. But to be exposed to sunlight in the middle of the day is great. Plus being in nature is an added bonus. Next slide, please. And finally, the other kinds of things that, I think that Dr. DeFish touched on as well are the kinds of threats to our psychology and the kinds of opportunities that exist. So one of the things in looking at all the factors that go into psychological well-being, researchers have focused on a number of key areas, and COVID has robbed us of a lot of our sense of personal autonomy and our mastery over the environment. These are two core elements of well-being. But our COVID era opportunities, what it's pointed out to us is how we can try to maximize our relationships, how we can try to maximize our acceptance of ourselves, to find purpose in life, and to focus on personal growth. These are the, if anything, the silver linings of the pandemic are helping us or giving us the time to think about what's really important to us. So the next slide. I think one of the things that everyone will tell you is that focusing on other members of our species is very important. I'm not going to go into a long rap about what this slide is. It's all about prairie voles. This is a species of vole that has high levels of oxytocin, and some people have called it the love hormone, but anyway, there's a whole brain biology underlying attachment, the connection to other people. And I think this is really an area where we need to double down, focus on our relationships, focus on our families, our friends, getting the kind of support and giving the kind of support that will make us all feel better. The next slide. Focusing on that, I found one of the advantages of masking is that I could develop closer bonds with a member of another species. That's my dog Maverick. And I also found that by sharing pictures like that with my friends, like next slide, I found that a lot of other people had relationships with their German Shepherds. And, I think that sharing with others is a way for us to be connected with animals and humans in ways that are actually supportive of our spirits. Next slide. So overall, I think that we're in a very strange period of time, one of the strangest I've experienced in my lifetime. And the question is, with this sudden bend in our existence, what are we going to do once that period is over? When social distancing ends, what will we choose as our next steps? And so I think that, now is a time, and as we're looking forward to being vaccinated, we're looking forward to a future where we may actually be able to see each other again, how are we going to use that time? So thank you for paying attention. Next slide. So it's a thank you.
Thank you so much, Dr. Builder, and to all the panelists. You guys went through a ton of information, really good information in a really concise time. So thank you. It leaves us lots of time for questions. We've had lots of questions in the Q&A. So thank you everybody for putting those in there, and please keep it up. We're going to kick off the Q&A with our first question, which is really about, like, once you have had the vaccine, what is the protocol for wearing masks or some of that stuff with, when you go back out in the world and you've already been vaccinated? So Dr. Shah, did you want to take that and kick it off, and we'll open it up to the other panelists as well?
Sure. Yeah, so at this point, there's still very, very few people that have been vaccinated when you take a look at the general population and compare the percentage. And so for that reason, we really do need to continue to practice all of our safety measures, wearing our mask, washing our hands, doing our social and physical distancing, everything that we've been recommended to do since whatever month it was last year, 2020. And again, because one of the reasons is that the studies, both for Pfizer and Moderna, really their endpoint in looking at what the vaccines accomplished were to try to avoid severe disease. They did not actually look to see if it actually prevented COVID-19 from happening to begin with. Now, the chances are, pretty low, but still, again, most of our communities have not been vaccinated at this point. And so we do not want to take the risk of being asymptomatic carriers and bringing, even if we're vaccinated, bringing something accidentally home to our family members or to our coworkers, et cetera.
Okay. Anybody else want to weigh in? I know, if you have family members that have been vaccinated, then is it okay to, be together and not wear masks? Is that recommended? I don't know if Dr. Kim or Dr. Yeganeh.
I would echo what Dr. Shah said. I think at this point, we need to get a little bit more information. I would hate to let down our guard and then have some sort of variant spread where the vaccine would not be as effective. We just don't have enough information about asymptomatic transmission right now with the vaccine. The one thing that people are looking at is, do you need to quarantine after you've been exposed as someone who's been vaccinated? And I think the CDC is actively investigating that information as well.
I just have to add to both doctors that are excellent response, but if you think of these vaccines as being about 95% effective, what about those 5% that get mild or subacute infections? Certainly they could be viral shedding, and so you don't want to pass the virus on to someone else if you're able to get mild disease.
So staying here a moment, panel, there have been a couple of questions about the timing of the vaccines. There's a great deal of anxiety about the second dose and what happens if you can't get your second dose on that 21st day or the 28th day. And also what would happen if for some reason you got one type of vaccine and then a different type of vaccine? Are there harmful effects from mixing them perhaps?
So I'm happy to start. So the studies were done with the Pfizer dose, the second dose being given 21 days and the Moderna dose being given at 28 days. However, from what we know about other vaccines, there's no ill effect on efficacy if you give the second dose later than that period of time. So there's no reason for us to suspect that if your dose is delayed by days or weeks, that it wouldn't be effective. Obviously, we want to give it to you on time because then you're more protected earlier. So, we do as much as possible try to do that. But if you happen to get your second dose a week later, a couple of weeks later, and even in England now they're doing it 12 weeks later, there's no reason to suspect that it would not be efficacious. The CDC has actually put out guidance about this, saying that if your dose is delayed, it's fine to delay it up to 42 days if there's no available second dose, because we recognize that there's so much scarcity. Again, based on what we know about other vaccines, there's no reason to think that it wouldn't be equally efficacious if you give it later than 21 or 28 days. And then the question about the changing doses, again, the CDC has also put out recommendations that if you, for some reason, can't find the same type of vaccine, it's okay to substitute with a different vaccine. Both of them are mRNA vaccines. They both are creating mRNA for a spike protein. They should both, trigger your immune system in the same way and boost your immune system in the same way. So if worst case scenario, you can't find, the Pfizer vaccine, you can get the Moderna and vice versa. Again, other countries like England, they're saying you can do whatever for the second dose based on the preliminary data. However, we do want to encourage people to follow the recommendations because those were the ones that were studied in the large randomized control trial. So it's not the end of the world if you delay your dose. It's not the end of the world if you get a different dose. It should be efficacious or effective, but try your best to do the appropriate interval.
Thank you.
Great. There's also a question maybe for Dr. DeFish and Dr. Builder about advice for supporting students who are struggling with a range of mental health concerns as we are looking to open schools. Any advice around supporting students?
Fish.
All right, I can start. So yeah, advice on supporting students. I mean, I think that it's really important for people in, the student's life to be, there for them and empathic and create structure and encourage them. I liked what Dr. Builder said about, really getting outside, doing activities, getting fresh air, but finding social supports and appropriate support systems when they need them. I know that a lot of students are struggling academically. And so really trying to advocate for students and how difficult it can be with virtual learning, whether that be getting a tutor or, talking to teachers. I think also getting therapy when it's needed and really trying to destigmatize that. There's a lot of support groups in the area as well that are done virtually. So I think that it's really important to just be attuned to those students and help them with their needs when you can.
Yeah, and I would just double down on providing the emotional support and the emotional connection to the kids. Because, much as, many of us are stressed by being in the Zoomosphere all day, it's, really difficult on these kids. And one of the best, most impressive studies I ever saw was done by some colleagues at UCLA, where they wanted to enhance the capacity of school groups to cope with trauma. So they had like a stress coping lesson they wanted to include. And the LAUSD was concerned about taking away the time for math and English. Well, it turned out, of course, that the kids who got the emotional support ended up doing better at math and English. So I think that, I would worry more about getting that emotional support to the kids, being connected with your kids, making sure they're okay if they are showing signs of irritability when they, much more than they did before, if they have sleep problems. I mean, you're the line of defense, knowing, how the kids are doing overall. And so I would watch for those kind of changes and get the help that you need when you see those signs.
I'm going to return for a moment to the question of the vaccines and their safety. We've gotten lots of questions about the other types of ingredients in the vaccines. Could you speak for a moment to what else is in the vaccine, Dr. Shah?
Yeah, so, there's a list of certain things that I'm probably not going to be able to pronounce here right now. So the CDC does have a full, very easy to read list of the ingredients that you can look both for the Pfizer and the Moderna vaccines. Just to point out, as far as people being worried about allergic reactions, the main thing to know is something called PEG or polyethylene glycol, or if you have a known allergy to something called polysorbate. Those are really the two main ingredients. As Dr. Kim had alluded to, there's these, like little fatty, I don't know how to, like clouds that the mRNA vaccine is packaged in. And it's that part that has been shown to really produce these allergic reactions.
Just add to the fact too that there's no mercury in these vaccines. They're considered preservative free. So the thimerosal that's in some of the other vaccines is not there. There is a bit of sucrose, a little bit of sugar, but you're not going to gain weight from it. And that's just to protect the vaccine from getting destroyed at the ultra low freezing temperatures. Extremely safe, a little bit of saline.
Great.
Thank you.
Thank you. One other question around if we're ramping up vaccines in the county and the country, are we ramping down testing? And how does that impact our understanding of how people are infected with COVID-19?
So I think that question is meant for me. We are still trying to test anyone who needs to be tested. So anyone who has symptoms, anyone who's been exposed, anyone who has not had symptoms or exposed but wants to get tested should be able to access testing. We still have our testing partners in place. You can see the numbers of tests we do each day. There's a nice chart of it on the LA County Department of Public Health website. And so it does differ a little bit. Some days we have to do 50,000 tests, some days we do 70,000 tests. But that, so there is a little bit of variance, but, most centers that I know of are continuing to do testing. And I think there's a lot of interest in doing asymptomatic screening as well at many different hospitals and professions. So definitely there's no trade-off that we've tried to make sure that we have the capacity for both of those.
And then we'll stay with you for a moment, Dr. Yeganeh. Any advice for people who are frustrated with the scheduling system? And do we have a crystal ball about when our allocations might increase?
So I would say that I'm extremely frustrated as well. It's just the number of doses. We have so few doses, and whenever we put our appointments on, they go really quickly. And we want to make sure that we're doing this equitably. And unfortunately, because we're so interested in getting as many people vaccinated as possible, as quickly as possible, we've had to resort to these megapods and these systems that are on the computer, which is difficult for people who are not computer savvy, people who maybe don't have good internet access, and people who don't drive a car and can't get to, all these different locations. So definitely, I feel your frustration. I echo it. And we are doing our very best to make it as easy as possible and to try to come up with different systems to get people vaccinated. As far as the crystal ball, I also don't have that. I'm excited for Johnson & Johnson. It'll be nice to have a third producer of vaccines. I hope that will increase our production in the upcoming weeks. But yeah, I think mRNA vaccines are difficult to manufacture. They're a really exciting technology, but it does take time, and I think everyone's trying to do the best they can.
It's an amazing opportunity to practice Zen. When there are things that we don't have control over, those are the things that usually lead us to the greatest frustration and irritation. So it's very difficult, but yeah, you can see it as an opportunity to enhance your meditation practice, breathing practices, coming up with other ways to tolerate the necessary wait. Within 6 months, 9 months, however long it takes, it'll happen and life will be better.
I think related to that, we talk about coping and resilience and trying to, deal in the moment with uncertainty and all those things. Are there things that you would recommend for, say, organizations or communities around programming or planning for the future when more of us are vaccinated and we've hit that herd immunity that Dr. Shah was talking about? But are there things that we should think about in communities for sort of planning ahead to look at the future and what people might need coming out of this sort of critical emergent issue that we're in now? And I would say that to our mental health providers, but also to, some of our public health providers as well.
I'm happy to get the ball rolling, as I just came from a series of meetings that we had at UCLA campus about how to do this the best way we can. We have a work group on wellness, well-being. I think one of the messages we learned from the CDC and some of the leadership there is that, especially in organizations, the biggest benefits often come from having the managers trained in the expectations they have of their employees. So a lot of the efforts focus on individually based treatments, interventions, how to cope. But if we all can look in our organizations, which includes in communities, for people who are leaders and managers, and deal with what are the expectations for the other people who are in that community, in that organization, they can help to set the standards of what to expect. They can also work on decreasing the sense of stigma that people associate with having any issues with their mental health. There's no reason we should be less concerned about being anxious than we are about having gout or kidney disease. So, I think that changing that threshold, being more tolerant of people's anxiety and being attentive to each other. If there's anything this pandemic has helped us to realize, it's how important we are to each other. And so I think that if we can all connect more intentionally to all the people around us, forge those connections and pay attention to the well-being of our friends, our community members, that will go a long way towards making the future brighter.
Thank you.
So I'm asking for a crystal ball again. As we look into the future, we're receiving questions. Will we need an annual booster to this vaccine? Do we have any information on that yet? And then there's curiosity around some of the other products, AstraZeneca, or some of the other things that are happening in Europe. Would we expect to see maybe even a fourth vaccine here in the United States?
I can kick off a little bit to the first question. Time will tell, but there have been some suggestions that this vaccine, the messenger RNA vaccines, can immunize us for about 2 years. I think it's going to come down. Well, we'll know moving forward. With regards to other platforms, so the Oxford AstraZeneca, was that what the question was about? The others? Yeah, so there's the Oxford AstraZeneca vaccine, and then the Johnson & Johnson vaccine. These are adenovirus-based technologies. So this is an adenovirus, at least the ones they're using, causes a cold in a chimpanzee. And so we stick a little spike protein on it, and Oxford will be a series of 2 shots, Johnson & Johnson is 1. There is another platform too called Novavax, which is really amazing. That, if we ever get to that one, it has right now about an 89.3% efficacy. And it's an interesting platform called pre-fusion protein. I don't know too much about it, but it's really, I'd like to know more about it. It looks really interesting. If any of the other docs has some ideas on that, I'm all ears.
So I think all our vaccines are looking at the pre-fusion formation of the spike protein. And it's just because that seems to produce the most robust immune response. So whenever you see the pre-fusion spike protein, your immune system goes wild, and that's what we want. I believe the Novavax is a recombinant vaccine. It's basically purified spike protein grown in an insect and then purified and used as a way to trigger your immune system to react and recognize it as foreign. And yes, I think an interim analysis was done on it and looked very, very promising. I'm sure we'll have tons of vaccine candidates soon. And I think that it's very exciting that we've been so successful. I think more than 100,000 people now have been in a trial for a vaccine, and we've had 0 deaths in the people who received a vaccine, including the mRNA vaccines, the adenovirus vector vaccines, the Novavax vaccines. You know, these vaccines have all been extremely effective at preventing death. And I think most of them have been highly effective at preventing serious illness. And I'm okay with getting a little bit of a cough and runny nose if it means that I know people won't, die from this illness. And so we're so very lucky.
I'm just going to piggyback off of that, maybe to a little bit of a different topic, but just with the concern about mutations and the different strains as it relates to this, because I know that's a common question as well. And as far as boosters go, again, we would hope that the vaccine does, the 2 vaccines, at least right now on the market, do last, as Dr. Kim said, up to 2 years. Of course, that there are these variants now, and the vaccines, I want to make sure everyone understands, are effective against variants. I try to simplify this as much as possible. I have 2 little kids who love Legos. And so, if I were thinking about 100, if they built just a tower of 100 blue Legos and, they replaced them with like 3 yellow Legos, for the most part, I'm still going to identify that as a blue tower. The more yellow and maybe now red, green that you start incorporating, the more different that spike protein on that coronavirus looks. And it may not, those antibodies that we're producing with these vaccines may not recognize it as much. So you're still getting some protection. I want everyone to realize that it's not that it's an all or none effect, but will we need a booster at some point? It's possible. And it's also important to realize how important it is to get as many people vaccinated as quickly as possible, because the viruses are mutating so quickly because they are replicating so quickly, meaning they're infecting so many people at such an alarming rate. And that's how they're able to produce these mutations so much quicker than a lot of other viruses we see.
Dr. Shah, you mentioned antibodies, and we are receiving questions about, are there differences between the antibodies that are developed when you contract COVID-19 naturally versus the ones when you receive the vaccines? We've also received a question, should you have an antibody test before you have a vaccine? Is there any purpose in the antibody tests at all now? Thank you.
Yeah, so I'll actually answer the second portion of that question first. And no, there is absolutely no reason to get the antibody test prior. Even if you have a detection of antibodies, we don't know how long it's going to last. We don't know how effective it is. So it is best just to get the vaccine. So no, you don't need any kind of testing beforehand. And as far as the difference between antibodies produced from natural infection with your body fighting it compared to the vaccine, it's very similar. The biggest difference is that when you're giving a vaccine, you're telling your body to recognize just this spike protein. And so it's producing antibodies specifically, or as I just like to refer to it as an army against this bad guy. And if you have natural immunity, you may be getting other portions of the virus and antibodies against that as well. But as others have alluded to, the spike protein is pretty much like the target for coronaviruses.
Thank you.
Right.
I remember
Well,
most of the
go
studies
ahead.
that your immune response is much stronger to the vaccine than it is to natural infection. So it seems like your body, you're forming antibodies, which is a very important part of your immune system, but you also have T cell response and other memory cell responses in your immune system that seem to have a stronger reaction to the vaccine than to natural infection. So our hope is that natural infection provides some level of immunity, but the vaccine will provide more thorough immunity.
Thank you. Great. Well, this is our fourth of the series, Safe in the South Bay series over this long, almost a year that we've been in. And one of the things we love to end with is with our panelists is to pose a question about really asking you what gives you hope in this long journey that we've been on. So I think I'll start with, maybe I'll start with Dr. Builder, if that's okay. And we'll just go around to all the panelists. So what gives you hope?
Yeah, I think that we've been in such forced separation from each other that I think it's led many of us to realize that we really value being together. So while I know that many of us have individualist goals, the collectivist nature is something that I think is being reinforced by this pandemic. And we realize how important other people are to us, how important our communities are. And so I see great hope in greater connection going forward among people, looking past what differences we may have and finding how similar we are. We have this external threat that we're all facing. Let us unify together for the greater good of humanity and forget the little differences that we have, whether it be over politics or other issues. That's my big hope.
Thank you. I can call on people or you guys can just pop up. Yeah, Brittany.
That was great. I love, I definitely agree. Common humanity and connection is very hopeful. I think for me as well, finding small things that give us purpose each day. The book Man's Search for Meaning, Viktor Frankl talks a lot about finding small things that give us purpose and give us hope. And so I think that for me, it's all about finding the compassion and the mindfulness in even the mundane tasks that we're doing and trying to create hope in that.
I'll go next. I'm going to say the obvious answer, which is vaccines. And that's really coming from the perspective of being a physician and being in the hospital and in the clinic setting and seeing the despair, honestly, the burnout rates just of all of the medical staff, coming down from the food workers to the nurses, to the respiratory technicians, of course, to the physicians and the nurses. It's been a really, really long, drawn out process with a lot of death, a lot of just unfortunate circumstances. And, for the first time when in mid-December, when the vaccine came out, we really saw a glimmer of hope amongst our staff, amongst our, just everyone who works in the clinical care setting. And it was just so infectious. It's just amazing what it has done. So, the vaccines just bring so much hope. And I really hope that we're able to ramp up that production and get that crystal ball going.
Thank you.
And I guess I'll go next. So mine as a pediatrician, of course, is it's been really hard seeing how the pandemic has also affected our children, and especially children, closing down our schools and closing down a lot of our community resources that usually children have. And I'm seeing glimmers of hope. My fourth grader or third grader actually just went to school for the first day all year this week. And so just seeing that there might be this opportunity for children to be able to find this like life that's outside of my house and outside of, finding the important resources that are available in our schools. I'm hoping that will continue and that more of my patients will be able to go to school. I've just seen such a huge dramatic toll that it's taken having the schools closed on their mental health, on their physical health. And I'm hopeful for them.
And I agree with Dr. Shah too about the hope with vaccines, but taking that even a little further, the technologies that have been honed and developed to bring these vaccines to us, and then just the global concern. We've been so, each country in America has been really kind of focused on America, but this has been a global problem. So I'm hopeful moving forward, that we can start looking at infectious diseases as a global problem and work on them as a global community. I know we're suffering here, but you think about Africa and South America and some of these other countries that don't have our resources. I'm hopeful that we can come together as a global community when these things happen. The other thing too that's kind of interesting is how we can really put our nose to the grind and get something like these vaccines put out and through the system so quickly, 9 months. I mean, my goodness, I think there's going to be some Nobel Prizes coming out on this, and I'm hopeful that those people get the recognition they deserve.
Thank you to you all. And I think we're moving on to resources. Is that right?
Yes, yes.
Okay.
So as we wrap up this evening, we want to make sure that our community has access to resources. So here on the slide in front of you are both our Beach City School Wellbeing Line and our what we call affectionately Extension 256. It's our information and referral line. So on both of these lines, we are here for you to answer your questions, to troubleshoot your trouble with finding your vaccine appointment, all sorts of help with errands, and then of course getting kids back to school. So please know that you are not alone. If you are struggling and frustrated in this process, you can call us here at the Health District. The telephone number is 310-374-3426. For the school wellbeing line, you press option 2 on school days between 7:30 and 4 p.m. We are answering our extension 256 7 days a week between 8:30 and 5. So please call us. Other resources in the community. The county has done an amazing job with all of their resources on their website. This is just a sampling of the beginning of what they've provided in terms of checklists and fact sheets and all sorts of guidance. So please consider looking there as well, particularly if you need a good handout for a friend. Lots of great resources here as well. And then as we wrap up tonight, we're encouraging our community to take a pledge for being safe in the South Bay. We will drop the link to this in the chat and into your follow-up email, but we encourage you to pledge for how you're going to help us in our community recover from this pandemic as we do move forward in vaccines. And then finally, this is our website, and again, extension 256, and then I'd like to turn it over to Tom for your closing remarks.
Great, thank you, Carrie Ann, and thank you, panelists. If we were live and in person, we'd all be applauding right now, so thank you very much. I don't know, yeah, I guess you can do that here. So thank you very much, panelists, and thank you, staff, for pulling this together. And thank you to everyone in the community for joining us. And I think as we've heard tonight, this is something that we do together, and we're doing it together, and we look forward to continuing those efforts at the Health District. We're here for you. And so if you have any questions or need anything from us, we're here as we move forward together. So with that, I'd like to wish you a good evening. And again, thank you for being here, and we'll be seeing you soon, I'm sure.